Welcome to Partners in Pancreatic Cancer. My name is Dr. Vincent Picozzi. I'm a medical oncologist at the Virginia Mason Clinic in Seattle, Washington, with a special interest in pancreatic cancer. I am also the director of our Pancreas Center of Excellence. I am frequently asked as a question, what clinical practice guidelines are recommended in the treatment of pancreatic cancer? This is a little bit of a complicated answer, and I'm going to take a couple of minutes to explain what clinical guidelines are and are not, and how they are utilized. First of all, a clinical guideline is a collection of scientific evidence as it applies to the course of events in the treatment of a sequence of any disease, in this case pancreatic cancer. Now, it's important to know that scientific evidence of an exacting nature doesn't exist for each and every circumstance that can arise. So many times the scientific evidence is buttressed by expert opinion. So what guidelines are a useful resource for doctors, patients, families, in terms of what represents good practice throughout the course of events. What guidelines are not are a complete body of scientific evidence for each and every situation. And guidelines are also not a mandate because they don't apply to each and every situation, and they're meant for the average patient, but not for a patient who's exceptional in some way. And so guidelines should be, I believe, regarded as a foundation for best practice, but not the ceiling of best practice. It's also important that, that guidelines acknowledge clinical research and clinical trials as an important aspect of good care. So most guidelines do incorporate clinical research and clinical trials as a valid method of treatment. There are different types of guidelines. Some guidelines deal with the overall management of the entirety of a disease. And in this country, the most commonly used guidelines for pancreatic cancer are those developed by the National Comprehensive Cancer Network, which has developed guidelines for all the major cancers. In Europe, a set of guidelines have been developed by the European Society of Medical Oncology. These guidelines are similar, but not identical in their content. There are also guidelines for specific aspects of treatment. For example, with respect to surgery and surgical decision-making, there are guidelines on operability of pancreatic cancer that have been generated by organizations such as the HPBA, the American Hepato-Pancreato-Biliary Association. And there are guidelines for supportive care, such as pain management, use of growth factors to support blood counts, that have been developed by organizations such as ASCO, the American Society of Clinical Oncology. So to summarize, guidelines provide a foundational knowledge base for the management of all cancers, including pancreatic cancer, but don't exist as an end-all and be-all for all patients in all situations, and certainly do not supplant clinical trials as a method of treatment in its entirety. I thank you for viewing this activity, and for additional resources, please be sure to view the other educational activities on partnersinpancreaticcancer.com.